What's going on, everyone? Happy Wednesday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Wednesday edition of the Pandemic Update for Wednesday, April 17th, 2024. If you're new to my channel, this is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, COVID is still a real threat, and there are a lot of other viruses out there that are wreaking havoc and could be a threat to your health. Want to be informed with what is going on? Then by all means, subscribe to my channel down below. Like the content you see here, give it a thumbs up. If you think more people should see this content, then by all means, share this with anyone you know. And if you have a comment on anything you see in today's video, leave a comment down below. Alrighty, today we do have several news stories that we're going to talk about, and plus we're going to talk about an addition I did make to my website, datareport.info. I think it's a good addition. It's something that was needed. I've been thinking about it for some time, and some more studies came out recently, which I think you know where we're going. We're talking about the study section of the site, and then we're going to take a look at some data, some more Walgreens data as well, a few wastewater sites, and some of the regular data that we take a look at. Alright, we have to start off with some bad news. So we have been in a law that has been ongoing with COVID since about the end of the holidays. Things started dropping. Then there was a little bump in the road that came around the end of January heading into February. And at this moment, we are still dropping, today being April 17th, but that's not going to last all that much longer. A new forecast has been released by Jay Weiland, and unfortunately his model shows the law is going to be coming to an end sooner than expected. Take a look here at this chart. You can see here, yes, there is going to start being a rise again from COVID. JN.1's subvariants, we've been talking about them recently, and we can actually jump ahead a little earlier than we normally do. Taking a look at the latest variants, we can see here, there's JN.1, right? That's at 83.7% of the cases. But then you have a JN.1.13, JN.1.18, and a JN.1.16, which all are increasing. JN.1.13 is increasing the most, and that combination, we're going back into what I'm calling JN.1 variant soup. It's possible that it may now start causing a rise, and then there is the significance of FLIRT, which carries some uncertainty. Not going to really, I'll be honest with you, I don't really understand what all that actually means, but in his terms, it is showing an indication that infections are starting to rise again after bottoming out in late April. And we have seen in other years where we do see a spring wave. 2022 comes to mind. This would be around close to the same time 2022 started to rise, and many of us remember in 2022, we had that little bit of lull after the winter wave. Then we started to rise in May. That went up a bit. Then it dropped a little bit. Then it went up a little bit higher. Dropped a little bit. Then up higher. You get where I'm coming from. The spring, leading up to the spring, traditionally has been the lowest period of the year. Last year we had cases rise again starting after 4th of July. We really didn't have much of a spring wave in the United States. The United States fared pretty well, and levels, they dropped through to about start of summer. This year, it may be a different story, so I just want you to be aware. There's a new model forecast, and this is not the only model. There's another model out there. I don't have it up here, but there's another model out there that's also suggesting that things may start to rise or bounce around. I think we're at the lowest level right now, according to these models. So, yes, that is not good. And then there's this. This is not good as well. COVID-19 poses greater risk of death to those with cancer. Large study finds. You want to read more about this? I did tweet this out, and this is a rather large study. So, yeah, this is something that we need to be concerned about. And I just want to read this little excerpt. One of the largest studies of its kind compared more than 6,500 cancer patients receiving treatment with more than 177,000 non-cancer patients. So, yeah, this is pretty significant in all. 31.7% of cancer treatment patients died at 30 days, significantly more than for non-cancer patients, where 18% died 30 days after contracting COVID-19. The point I'm trying to come at here is we need to protect those who are at highest risk, and we're not doing that. I don't understand why. There's plenty of studies and evidence that say those who are at high risk of COVID could undergo hospitalization or could even die from the virus still. Just because, oh, well, it's been since 2020, it's now 2024, it's not a big threat anymore. Okay, guess what? It is still a big threat. And you know what else is still happening? Perfectly healthy people that don't have cancer, that never have had health issues, they're going on to develop long COVID as well. So, yes, we need to continue to take this serious. And if you haven't been taking it serious, start taking it serious again. And before you put that silly comment down below that's laughing at this, I removed a few yesterday that were just utterly ridiculous. Think about it. Those who are at high risk are still dying. And yes, I know, you're going to put that comment down there, oh, we can't just mask up to save grandma. Guess what? We can. We should. All right, Arizona, speaking of long COVID, Arizona's long COVID rate is higher than the national average, and Hispanics experience symptoms at a higher rate than other groups. So this is rather interesting, and this is something that is concerning as well. If you want to read this full story, again, we don't always read full stories here, because if we did, my videos would be 30, 45 minutes. Who wants to sit through a 30-minute? 15 to maybe as much as 20 minutes will be as long as we go with these videos. Anything longer starts to get a little bit ridiculous, in my opinion. All right, this is not good. Public health, this has to do with Seattle now. Public health is monitoring measles exposures among international travelers visiting Seattle, and there's a group that has set to visit Seattle. They are visiting Seattle right now. They were exposed to measles prior to arriving in Seattle, and currently there are no cases, but hey, within Kings County, the health department is monitoring the situation closely. I also tweeted this out, and now I wanted to show you this from my website. We did make a change in the COVID studies and papers section. While we already had a COVID in kids section in the general COVID section, I thought it was important that we added a section called Studies on COVID in Kids. So you may see some things that get posted a second time in Studies on COVID in Kids, and you may see some things that aren't posted in the other section and they get added here. And I think it was proper to split them up, because yet again, miscellaneous COVID studies and papers keeps filling up. It keeps getting really ridiculous, and I like to keep it as organized as possible. And as I find more studies, I keep thinking, you know what, let's just give it its own section, because it's just as important as all of these other things. And then there's something else that has been posted on my site. You may have seen this yesterday. There is a new strain of Mpox that is being found in the Democratic Republic of Congo. And the concern with this is it's able to spread better, it's able to evade previous tests, and there are currently 100 confirmed cases and 241 suspected cases. So that is quite a few cases this year that have already been found. Of course, as we find out more about this, I will report on it. Hopefully, this is not something that goes global once again, but we'll have to see what happens with that. Now, taking a look at today's air qualities as we wait for this to refresh, and we can see east of the Mississippi River, well, southeast of the Great Lakes, I should say. Yeah, a lot of yellow showing up today. And there is also a ton of yellow and orange showing up in Texas as well. The Carolinas are not doing too great. The Mid-Atlantic, some poor air quality. So lots of reasons for concern with the air qualities in the east today, but not so much in the west coast, at least not the Pacific Northwest. California still has its typical spots that are problematic when it comes to air qualities. All right, moving on, taking a look at today's severe weather threat. There is currently an ongoing threat. Let me change this. There's currently an ongoing threat in Ohio. If you live in Ohio and western Pennsylvania, please pay attention to what's going on. Be weather aware. There have already been multiple tornado warnings, which one storm that looks really nasty. Please be weather aware. And tomorrow, I want you to be weather aware if you live in Illinois, western portions of Kentucky, northwest Tennessee, eastern Mississippi, and even portions of Indiana and Arkansas. Please be advised there could be some tornadoes tomorrow, and that can be dangerous to you as well. All right, take a look at EMS calls in Philadelphia yesterday. 758 EMS calls were reported. Doing a live look in at what's going on in Montgomery County, Pennsylvania. Respiratory emergencies showing up, vehicle accidents, building fires, cardiac emergencies. So there are some calls to be had right now. I can tell you right now, I was listening to Philadelphia. I was listening to some of the EMS dispatch, which I can do, and I was listening to at least a North Medic band. It's pretty busy today. There were quite a few calls ongoing earlier, so that's not good. And I did hear the words breathing difficulty showing up several different times. So that is always concerning. Taking a look at Chester County, Pennsylvania, and we can see here, sick person shows up a few times, injured person a couple times, syncopal episode, emotional disorder. So there's a few calls, but not terribly busy right now. All right, let's go over to Walgreens and take a look at some more states today. First, the national positivity rate is at 13%. 13.5% was last week's positivity rate. That is down by 0.5%. Total tests, 4,875. Prior week, 5,867. Let's go up to Minnesota and see what's going on there. Well, we do see that there's a big drop in testing, which, as you know, when testing drops, more times than not the positivity rate rises. Minnesota, for the current week, they are at 16.4% positivity rate. The prior week is 3.9%. That's a difference of up 12.5%, but hey, testing's way down. 61 tests versus 103. And yes, before you say down below, oh, well, it's only 60 tests. I know. It's little testing, but you know what? Any data is helpful. I know the less testing there is, the less useful it is, but at least we are getting something. Let's take a look at what is going on in Oregon. Oregon, the positivity rate is 10.5%. The prior week was 7.4%. That's a difference of up 3.1%. Total test, 19 versus 27. So again, this is a reasoning being because of lack of testing, which is why you're seeing positivity rate increase. Tennessee, what's going on there? 8.4% this week. The prior week was 15.2%. Difference of down 6.7%. Total test, 202 versus 244. Your testing's down, but the positivity rate is down, so not much of a concern for you. Georgia, 8.9% positivity rate this week, 15.7% last week. Down 6.8%, 225 tests versus 223. Testing's up, positivity rate dropped. Not much of a concern for you. Can we do anything for Texas this week? Yes, we can. 11.8% positivity rate this week for Texas. 12.1% was the prior week's positivity rate. That's down 0.3% with the positivity rate being down. Or excuse me, with the number of tests being down. 896 tests versus 1,084. So, hey, your positivity rate still dropped. That's not a bad thing. One last state, and then we do want to do two wastewater sites today. Maryland positivity rate this week is 18.9%. The prior week was 11.5%. That's up 7.4%, but hey, testing is down. Just 53 tests versus 61 this week. All right, let's take a look at a couple wastewater sites. I wanted to look at Harrisburg, Pennsylvania, because we have not looked at that area in quite some time. It serves 125,000 people at this wastewater facility. This is in Dauphin County, Pennsylvania, and you can see here, there has been an ever so slight rise in COVID at this time, taking it back to medium levels. RSV is flat at this time. Influenza A is dropping well, it's flattened out a little bit. Influenza B is definitely dropping. HMPV is dropping slightly. Norovirus still high, but is dropping at this time. Mpox, no cases detected. And hepatitis A, there are some minor detections of that. Next, I wanted to go out to the central region, and let's go out to Arkansas. Remember that site that had the norovirus issue a few months ago? Let's see what's going on there. COVID is dropping at this time. This is Harrison, Arkansas. COVID is dropping at this time. Only 15,000 population at this wastewater site. RSV is flat at this time. Influenza A is low. No issues with influenza B. HMPV is rising slightly. Norovirus starting to rise once again, so that's something we have to keep our eyes on. And it does look like it is back into the high category. Mpox, no issues with that. And there are some detections of hepatitis A at this time. All right, continuing on now, let's go over to emergency department visits, and we can see hospital admissions in the past week, 7,318. We'll get a new update on that on Friday. Taking a look at flu numbers. The only real place that we're seeing high levels still is in North Dakota. Then there are still a bunch of states that are in the moderate category, and that also includes New York City as well. New York City, Massachusetts, New Jersey, Michigan, Nebraska is still in the moderate range, as is New Mexico. And then we come down here, we see Iowa's in the moderate range as well. All right, New Jersey today, 196 hospitalizations. That's with 67 out of 70 hospitals reporting. 6 people on a ventilator, 22 people in the ICU, and there have been 26 discharges at this time. New York State, just another 294 cases, but remember, does not include the at-home test. Taking a look at New York State hospitalizations, and they did drop back below 500 once again. So my next target would be, can we get to below 450 by the end of this week, or maybe at some point next week? 499 people in the hospital, 47 people in the ICU. Finally, today we do come down to Colorado, and I think this updated for this week. Well, either way, we'll talk about it. Colorado on the 16th reports 77 people in the hospital. But if we come down here, we do see the number now says 86. So, conflicting data here. Let me refresh this once again. Maybe it'll actually correct itself. We see here, nope, it's still showing two different numbers here. So it says here on the 1677, but 86 down here. I think the 77 is the accurate number. Yes, it is. So it actually dropped on this week's number compared to last week. And I'm assuming the numbers down here may not be up there. This case is reported. That is updated. I don't recall seeing a rise last week. So they reported 673 cases. That is up by 42. Again, I think it's safe to say for many states, we're coming near to bottoming now, and we're just going to bounce around off the bottom. Although, like I just showed you with New York State, they're still dropping. So hopefully they can continue to drop. Alrighty, folks, that does it for today's pandemic update. We'll have another pandemic update again tomorrow. If you like this, give it a thumbs up. You learned something, you enjoy what you see here, you want to come back here and see my daily updates, subscribe down below. Know anyone who needs to see these updates, which is anyone who's at risk, which is everybody. Share these videos with anyone you know. Got a comment on anything you saw today? And I'm sure you do, after seeing that model data, seeing that we may start rising again come into the end of this month or start of May. Yeah, leave that comment down below. I'll see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Wednesday evening, and thanks for watching.